Hello and welcome back to the Men's Hub. So today we're going to be talking about something that affects men and women, but it affects men preferentially. It's a condition called hypertension, high blood pressure. Now there's a lot of conversation about whether or not this is a symptom or a disease, and we'll get to that as we go through this. Often it's defined as the presence of a chronic elevation of your systemic arterial blood pressure. So that is to do with your systolic blood pressure, which is the top on your readings, and the diastolic. Normally, whenever you are going to get your bloods tested, they will say that the normal reading is 120/80. But if you're 65 and over, a normal reading might be 135/88. And that depends on the practitioner as to whether or not they are going to be sensitive to your age and to how you present. It is strongly associated with functional and structural cardiac and vascular abnormalities that damage the heart, can damage the kidneys, the brain, the vasculature, and other organs. And it can lead to premature death, affecting almost 1/3 of the adult population, and most of those will be male. Now, orthodox medicine has a tendency to focus on your top level of your blood pressure or your bottom level of your blood pressure. But for clarity, I tend to consider hypertension stage 1 as being anywhere between 80 to 89. And it's generally measured by the GP in surgery. Now, the only problem with that is whenever you go to the GP surgery, there's a condition known as white coat syndrome, where the stress and trauma of being tested for your blood pressure is going to elevate your blood pressure. So the most reliable test is to monitor this at home for about 48 to 72 hours. Home monitors are useful, but they need to be calibrated with a proper machine so that you know they are reading accurately. Now, hypertension can be the result of the environmental and genetic causes, and that accounts for 90 to 95%. So most conditions that are hypertension or blood pressure issues are to do with environmental and genetic causes. The rest are because of renal, vasculature, or endocrine diseases, and that's about 5 to 10%. Now, pharmacological treatment involves angiotensin receptor blockers, which will work in the kidneys, calcium channel blockers, and diuretics as the first line of agents. Spironolactone may also be considered, and statins will almost certainly be prescribed because they're going to see that you have elevated cholesterol. Now, there's a lot of myths around hypertension, and I want to just touch on those first and foremost. So the first, most pervasive myth is that if you have started hypertensive medication, that you're on it for life. That is simply not so. Diet and lifestyle changes and herbs can help reverse high blood pressure. Secondly, that low salt intake is going to reduce your hypertension, and that's simply not true. Only a small proportion of people with high salt intake that induces hypertension, so therefore only a few of those genetically sensitive to salt are going to be able to reduce their blood pressure by reducing salt intake. Now, low-fat diet, reducing or preventing hypertension, again, that is simply not true. Let me repeat that again. A low-fat diet will not reduce or prevent hypertension. Low-fat diets lead to an imbalance of your lipid profile. This is an imbalance of your fats in your blood and often can induce obesity and cause you to get morbidly overweight and also clog up your arteries, leading to heart attacks and heart disease. Now, another myth is that if you will be okay if you lower your systolic blood pressure. Again, it's simply not true. So both numbers need to come down, and crucially, the range between the systolic and the diastolic, so that's between the top number and the bottom number, should be around 40, which is why 120/80 sounds great, but equally so would 130/90. It's about the elasticity of the vasculature. Now, the thiazidine diuretics that reduce blood volume in the long term, that is another myth. It's simply not true. The mechanism is not understood, but it's believed to be associated with vasodilation. So diuretics reducing the blood pressure is more to do with its impact on the veins than it is to do with reducing your blood pressure. If you're genetically predisposed to hypertension, then there's nothing you can do to prevent it. Again, simply not true. Lifestyle changes and herbal medicine can do an awful lot to lower hypertension. So there's different reasons as to why you might have hypertension in the first place. In most cases, there is no clear reason for the raised blood pressure. White coat syndrome would need to be ruled out. A person is very anxious of having the blood pressure taken, then avoid getting too fixated on your blood pressure readings. If you're an anxious person or somewhat obsessed about your health, then you may feel better off at home with the blood pressure machine. And even then, I've seen some people elevate their own blood pressures because they get agitated and anxious about taking it and seeing what the blood pressure is going to read. Other less common causes for high blood pressure include thyroid problems, kidney problems, tumors affecting the adrenal glands, and some heart defects. Now, self-help with herbal medicine is the most applicable in most cases of hypertension if it's anxiety related. If the situation's more complex, then you are advised to see a qualified practitioner who can guide you or work with a GP around any orthodox medication that you may have to take. Whenever it comes to assessing your risk, I recommend using an online resource called QRisk. It's an interactive calculator that assesses your risk of stroke or heart attack within the next 10 years. And if you play with the numbers quickly, you will realize that moderately raising your blood pressure has a very small amount of increase in the risk of stroke or heart attack. Similarly, if you take blood pressure medication, it will reduce your risk by about 1%. So the numbers really don't warrant having to take a high number of pharmaceuticals. Now, it's useful because the calculator allows you to make amends and to make any changes to your diet, to your lifestyle, and get a little bit more exercise and to look at what alternatives might be available to you rather than just going down the pharmaceutical route. And there's many factors that can lead to cardiovascular disease, but hypertension is the primary one. Others that will be associated with this are smoking, poor diet, obesity, and then comorbidities such as diabetes, high cholesterol, or high homocysteine levels. Sleep apnea and poverty are all associated with increased risk of cardiovascular disease. So interestingly, a poor microbiome is also associated with hypertension. A compromised epithelial function in the gastrointestinal tract can lead and develop into hypertension. I'll not go into the significance of that, but what you may be interested in knowing is that some probiotics may help actually reduce your risk of hypertension. Now, if you want to address your lifestyle, what things can you put in place to try and bring down your blood pressure? So first and foremost is breath work. And this is breathing in a 1 to 2 fashion. So breathing in for 4 through the sinuses and then out for 8 through the mouth. And this is regulation of your breath will actually significantly drop your blood pressure. You can address the microbiome with probiotics and that strong connection with gut dysfunction. You can try and pick up walking, cycling, or gardening for about 30 minutes a day, every day. You want to avoid trans fats. So I said earlier that a low-fat diet is not helpful. Any vegetable oils are not going to be helpful for your blood pressure. So ensuring that you're having healthy fats such as butter, olive, coconut oil, avocado, it is definitely preferential. You want to eat wild and organic fish in preference to meat, so perhaps 3 times a week, and becoming a vegetarian is actually really good for your blood pressure. You can exercise outside, which is much more beneficial to get access to vitamin D, and vitamin D will help to reduce your blood pressure. Keep coffee to 1 cup a day and consume lots of weak green tea. Reduce your alcohol consumption to a very occasional drink. It would be very nice if I could say that I was good at doing that one myself. Reduce simple carbohydrates. So these are things like crisps and potatoes. Any of the grains or breads that will spike your sugars. And then you want to reduce stress. So try not to keep late hours and to avoid any overtiredness or unnecessary worry. Relax, aim for a healthy weight and a healthy waist size, and try to stop smoking. So really do try to increase your amount of fruit and veg per day. So this is 7 to 10 portions of veg, and you want to try and include blueberries every day because they're purple. Anything that is purple is good for the blood pressure and the capillaries in your blood system. Interestingly, despite saying everything that I have just said about seeds, wheat germ oil can help feed the heart and cut cholesterol. So worth thinking about using short term. And with hypertension, cholesterol and mucus sludge from your body, you want to avoid anything that builds up mucus within your gastrointestinal tract. And you want to try and encourage the detoxification pathways. So try and think of things that are warming and moving. These are herbs such as cayenne, capsicum powder, garlic, pure tomato juice, all of which are really useful to help just get that sludge out of your system. Now, when it comes to supplements, there's a number of supplements that are highly recommended for blood pressure. B complex is right up there, along with calcium, CoQ10, fish oils. And then really the other significant ones are things like garlic capsules or magnesium taurate at 1,000 micrograms a day, which can have a marked impact on blood pressure. Potassium is another one that's really helpful for kidneys and just can balance out the sodium-potassium balance. And then vitamin D, vitamin E, and vitamin C. Now, I don't want to go through herbs particularly because there's so many of them. So, I mean, whenever it comes to hypertension and what herbs we could use for it, I'd probably have somewhere in the region of 35 to 40 different herbs that I could use. And it boils down to how you present in clinic. So one of the reasons you may have high blood pressure is just primary blood pressure. You might find that general cardiotonics or hypotensives, peripheral dilators, some diuretics, some vascular tonics, some nervines, antispasmodics, or circulatory stimulants may be used. And it just depends on how you present. So if you're somebody who's always anxious and has high blood pressure because of your anxiety, then herbs like valerian is really ideal for worriers who find it difficult to switch off. Passion flower, lemon balm, linden, skullcap, hops can all be considered here. And valerian combines well with herbs such as cramp bark, lemon balm for stress-induced high blood pressure. Similarly, Simisafuga, this is black cohosh, often used for females, but can really work well to help reduce arterial blood pressure. Now, if it's because the blood vessels are compromised and are weakened, then we want to try and strengthen them. So herbs like the purples I talked about a little bit earlier that can strengthen blood vessels are really useful. Most of the herbs here are herbs that contain bioflavonoids. And top of the list are things like buckwheat, containing the bioflavonoid rutin, and it's probably best eaten as a food on a regular basis. Also up there are hawthorn, bilberry, and lime flowers. The latter has the added bonus of being quite relaxing herb too. And hawthorn is a major heart and cardiovascular herbal tonic in Western herbal medicine. Now, herbs that keep the arteries dilated. So this is if you have stiffened arteries and that's causing your blood pressure. The herbs that I would go to for this are cramp bark, which is helpful for relaxing smooth and skeletal muscle, along with ginger, valerian, and hawthorn. And again, Simisafuga might be quite useful. When it comes to the kidneys and looking at diuretics to try and increase the amount of urine output and reduce the amount of water that's in your blood, then diuretics might often be prescribed both in orthodox medicine and treatment and then also in herbal treatment. We tend to use a really wonderful herb such as dandelion leaf. And dandelion leaf contains lots of potassium, which is wonderful for the kidneys because if you use a pharmaceutical diuretic, quite often your potassium levels drop, whereas we're giving you a diuretic that contains lots of potassium and therefore much gentler on the kidneys and much more suitable with other herbs like nettle and corn silk. Now, if you have blood that is sticky, so hemochromatosis, or if the red blood cells are a little bit deformed, then you want to have something that's going to keep the blood moving. And in this instance, garlic is ideal to keep blood thin. Ginger and ginkgo will also move the blood to the peripheries. Ginkgo biloba also helps to maintain blood vessel strength and flexibility. So you can drink plenty of water and stop smoking as soon as you can, and then get into some ginkgo, some ginger, some capsicum to keep that blood going. Whenever it comes to people who need support in their digestive tract, then I might consider something like golden seal, berberis, or rhamnus or senna as a laxative to try and make sure that you're opening your bowels every day. Now, just a few safety things. Don't self-treat with herbs without also having your blood pressure monitored by a health professional, even though it may spike it. Do seek out advice from a qualified herbalist if you are prescribed orthodox medicine before you start taking herbal alternatives. And do let your GP know, or other healthcare professionals know, that you're taking herbal medicine for your blood pressure. All of the herbs that I mentioned before, the king of the crop is garlic. It may not be the thing that your wife will love so much at night time whenever you go for the evening kiss, but it is absolutely excellent for lowering blood pressure and lowering cholesterol. Now, lastly, moving on to aromatherapy and some of the essential oils. So essential oils can be really quite helpful here at reducing blood pressure. Oils such as lavender, marjoram, ylang ylang, and ylang ylang has the benefit of being an aphrodisiac as well. And relaxing oils such as chamomile, rose, bergamot, and neroli are all helpful. So that's just to give you a quick summary. You will find that I have given you a handout with more information about hypertension, and you can kind of look through that before you decide what you want to do, if you want to self-medicate and try and manage your blood pressure that way, or if you want to come and see a herbalist such as myself. When it comes to cholesterol, just keep in mind that if you have had a heart attack, then there is some evidence to suggest that being on a statin is really quite helpful at preventing a second heart attack. If you've never had a heart attack, then actually there's very little evidence to suggest that those statins are useful. And for cholesterol lowering herbs, generally speaking, it's very hard to beat garlic or mushrooms. That's it for now. Speak to you soon.